I'm Lorena Hoeber. I'm the host for the Grad Student Life podcast, where we showcase and highlight grad students who have recently finished in kinesiology and health studies, and also talk to students who are currently in the graduate program to understand a little bit more about their experiences as graduate students in our program. So today we have Abby Phillips. So welcome, Abby, to our podcast. All right. So again, I'm going to start off with a little bit of getting an overview, because you recently defended your master's thesis. So can you explain a little bit about what your master's thesis was about?
Yeah, so I looked into how parents are coping, parents who have children with mental illness, how they're coping with the caregiver strain that comes along with that. Specifically, how they're using online support groups to cope. So that's really what my study was about.
Okay. And how did you do your study? Like, what kind of, I know that's getting into the nitty gritty about the methods, but how did you actually do it?
Yeah, so I did a survey. So I reached out to the online support groups on Facebook and requested permission, of course, to use those groups to recruit, sent out the survey. And then I also did interviews, which was actually the bulk of the project was looking at the 13 interviews that I did, but it was all just through recruiting through those online support groups and getting participants there. And then, the survey, and then.
And what were some of the main findings as a result of your project?
Yeah, so I unfortunately didn't get enough participants from my survey to really have strong findings from it.
Yeah, that's a reality.
Preliminary. Yeah. But the interviews were really great. I got lots of really interesting feedback, and largely the message was these groups are fundamental to help parents cope with the caregiver strain and to help them treat their child, which is concerning because that's where they have to go, right? It really draws a big light onto the lack of support these families have. And I did end up, my interviews were exclusively with parents who have children with eating disorders. And for anyone that doesn't know, when you have a child that has an eating disorder, the largest, most effective treatment is family-based. So they're instrumental in helping their child recover from the eating disorder. And the groups are fundamental in helping them be able to do that, in getting the information, the resources, and just concrete examples of how to help their child, which they're not getting from healthcare systems.
Right. So it's filling that gap that we don't currently have as services.
Yeah. Okay. And it's it's awesome that it's there, but it's also an unregulated situation, right? We don't know what kind of information is being said on these groups. So ideally, it would be nice if parents had somewhere to go that was a little bit more secure and regulated.
Right. So it is a good resource, but perhaps maybe not always the most trustworthy or the most reliable, but
yeah, you definitely have to go in knowing that you're going to get anecdotal information.
Right.
Knowing that you're going to hear a lot of really hard stories that might be triggering. So it's super, super beneficial, but there's definitely things that parents should be aware of when they're going to these groups.
Okay. So based on what you found, what kind of advice might you give either to, it could be parents, it could be the healthcare system. So there's a lot of different ways we can go this way, or people who are running these online groups. So I think there's a lot of different ways we can.
That's a big question.
Well, I mean, it depends on you. Where do you want to go with who could benefit from some of the research that you found?
I would tell parents that if you have a child with a mental illness, check out the groups. Don't put all of your eggs in one basket.
Right.
Of course, but it's worth checking it out. It's worth just having a peruse and seeing what other parents are going through and how they're managing. And there's so many different groups available. My participants largely came from an eating disorder support group, but there's groups for parents who have kids with schizophrenia, parents who have kids with just anxiety, just depression, for comorbidities. There's so many different groups. So just have a look. For healthcare professionals, I would encourage you to, if you've got the time, maybe partner up with some of these groups. Yeah. Get in contact with the admin. From my experience, the admin that I was able to work with are really gung-ho, and they want to, obviously, they're taking time out of their own lives to monitor these groups. So they're passionate about improving parents' lives. So like join up with them, try to put some more good information out there. There was a study where some researchers started a group. It was for people with like young onset dementia.
Yeah.
And like, so they've got the peer support, but you've also got like valid, strong, like evidence-based information coming at them. I would love to see more researchers try to do that, because there's lots of people in these groups, right? So it's a really great place to meet people where they're at, and like, why are we doing research if we're not reaching people?
Right.
You know?
So it sounds like it's primarily like these online groups. They're, are they started by parents, or are they started by people who work with some of the youth or things like that? Or just, I'm just curious of kind of where do they come from?
I'm not actually sure. I didn't do a lot of looking into that.
Sure.
From like the little bits that like one of my interviewees was an admin for a different group. And it sounded like from her story that it was just like, she had this experience, she wanted to help out, so then she joined. And she had like the extra resources after her child was in recovery kind of thing.
Okay. Yeah. So I want to, before I get into, I'm going to get into some of the things about like you as a graduate student who also worked, and kind of what was that like. But maybe just a little bit about going through the process is that I think there is a sense, perhaps when people start doing research, that it is going to be linear, there's not going to be bumps in the road, that it's going to be straightforward, but it's not like that.
No.
So maybe can you highlight maybe some of the challenges with your own research, but also maybe some things that went well, like maybe some things that were like, that actually was, maybe quite enjoyable, or I like that part, but kind of highlighting both sides of it.
Yeah, like I really enjoy research. I really enjoyed the interviews. Like, it's such a privilege to be able to have that kind of insight into people's lives.
Yeah.
Like, it's really a precious gift. So that was like absolutely wonderful. Challenges, like I wanted to get in and out in 2 years.
Yes.
And I didn't do bad.
No, you weren't that much over. Yeah. But what are some of the challenges in doing it? Because you're right. Typically that is, I don't even think it's normal anymore, but it's kind of the sense that you're done in 2 years. But what are some of the challenges in actually getting done in 2 years?
I think a big challenge is communicating with your supervisors, your expectations. Like I definitely wish that I had been a bit stronger in communicating my needs. I think as a student, you don't really realize that you're kind of becoming a peer with your supervisors. You're still thinking of it as this like power dynamic or whatever, where they're over here and you're over there. But like, that's not the best way to go about it.
No,
you know,
right.
Like it's better just think of them as a colleague. You're working together. You're on not necessarily equal footing. They are a mentor, but like if you want things to get done a certain way, you need to advocate for yourself, and you need to be like on it. You can't expect them to be doing that for you anymore. So like a little bit more of like that knowledge right off the get go. Like I don't know if it would have been beneficial. I'm a little bit passive, but maybe.
No, but I do like that piece of advice, because I think it is also a big transition from undergraduate to graduate to realize as an undergraduate, it is a hierarchy. There is a big difference, and you're right. You're still learning as a graduate student. But that idea of working together with other people and communicating, because they may not know and understand what you need as a graduate student. So I think you're right. It's to advocate for yourself about, how many check-ins do you need? What kind of feedback do you need? How quickly do you need things turned around? So I think that's a really good piece of advice. Yeah.
Like I was always just so worried, like, oh, I'm nagging them, or, oh, like I'm being too much. And it's like, no, you weren't at all. Like, like that's just how it goes. Everyone's really busy. Everyone's got 100 different things on their plate. Like if you want something done, you need to be the one taking ownership of it and taking care of it.
And I think on the other side, as someone, because I do supervise students as well, is I think we know that going in, that, you're going to come with requests or things need to be done. And when we understand that, and you're right, we are always busy. But we are there to support graduate students as well. So it is, you don't have to apologize. Maybe the 1 day turnaround, those are challenging to do sometimes.
No, I'm definitely not advocating for like unreasonable, like I want this done in a week. Like, no, like you need to understand like their schedule as well. So like, yeah, I guess you could be on the other side of the spectrum, but like it's just communicating. Like if you're not going to communicate and let them know, how are they supposed to even try to accommodate? So
and I really like your point too about don't worry about feeling like you're bugging them, because that's the expectation. The expectation is that we're supposed to be
right. You signed up for this.
Yeah.
We both signed up for this. So
you did. So don't be shy about it.
Yeah.
And again, those can be worked out in that way.
Right. But you need to communicate in order for it to get worked out.
Yeah. So I want to move into a little bit, kind of again, based on your experiences now having gone through this, but I want to go back to a little bit because you talked about interviews and that you really enjoyed that and that was a real privilege. Can you give advice or some things that you learned about interviewing to other grad students that might want to do that as part of their data collection?
I think the big thing is making space.
Yeah. What do you mean by space? Like physical space, time space?
Well, mine were all online, so they had lots of space from me. I mean, like time.
Okay.
Like be okay with just sitting in like a little bit of like quiet, because I always feel the pressure to like fill the void and like, you know, keep things moving. But sometimes they need to think, and sometimes they're processing their own experiences while they're doing the interview. So it's good to just like be okay with a bit of a pause and like asking like, are you ready to move on? Like, and active listening. It's always really like the questions you ask are only so good, right? Like you don't know what you're not getting.
Right. Yeah.
You don't know what questions would have been better. So it's really important to really listen to what they're saying and try to like do follow-up questions to make sure that you're really understanding what exactly they're trying to say to you, and to catch different themes that you wouldn't have thought of, because like I don't have lived experience of having a child with an eating disorder, so I don't know what I don't know.
Yeah.
So you really just gotta like obviously follow your script, but ask those follow-up questions to make sure you're understanding and like the full breadth of their story is getting to be told.
And I like a couple of different things. One of them is that silence, because that's really difficult. It's uncomfortable, it's awkward, but
sure.
It's also important to realize that some people do respond very quickly, but not everyone does. And I think it's being respectful to different people, kind of, as you said, to how they process things and not rushing people, because then I think you're not really going to get what you want from different people. So it's not meant to be like 10 minutes of silence, but it is a minute or two of...
And it might feel like 10 minutes. Like sometimes for me, I'm like, ooh.
Yeah.
But being reasonable about it. But
and I also like the idea too that we do go in with some ideas of what we're looking for. But I think that's the beautiful part about qualitative is you don't always know what you, as you just said, what you don't know. So it's that sort of serendipity and that sense of maybe coming across things that you didn't realize were important, and but that comes from the active listening to people and how important that is. And
then you can, like, if there is something that comes up, like you can ask your next participant about it. And like, it's so exciting when they're like, oh yeah. And I'm like, well, thank goodness I was paying attention.
I know, because and again, the point is that at the beginning, you're not the expert. You learn from listening to them. Yeah. But again, you're trying to guide that conversation to get at some of those things, but also being open to things that are unexpected that then do become, as you just said, too, very important in future interviews. So it takes time to develop those skills, but when you get them, it's fun. Yeah,
I guess also just like be patient with yourself and don't expect yourself to be an expert right away. But
it's not. It's a learning process. It's a practice, just like anything else. So that's part of what graduate school is about. And you get better with it the more you do it. So if you were to go back to when you first started, what advice would you give to first-year Abby?
Stay on top of your supervisors.
Okay.
Like, actually communicate.
Yeah.
Don't be so scared. And then I would probably tell myself to, like, be a machine when it comes to recruitment. I was definitely a little bit more hesitant in that. I just like the idea of like pestering people is just challenging to get past.
Yes.
And like wanting to just get it done really quickly. So probably need to tell myself like it's going to take a minute, prepare yourself for that, and like make a solid plan before you start doing it.
Yeah, recruitment is difficult. And I think there is a bit of a level, I don't want to say it's exactly like sales. It's not. But you do have to get out of your comfort zone that sometimes you do have to keep going back or not necessarily pushing people, but asking again multiple times.
Yeah.
It's not a one and done.
No. Like you have to actually make sure people are noticing you. Especially nowadays, there's so many things to be paying attention to. And like if it's not going to grab your interest in like 5 seconds, it's not going to be retained at all.
Yeah.
So you definitely have to think of it a little bit more. Like, at least I want to get your attention. Like, feel free to ignore me if you're not into it. That's fine. But like, I want you to at least know that this is an option.
Yeah. but I think you're right. There's so much information, so much stuff that's going out there that you can't just assume that people are going to notice you.
Yeah.
That's unlikely. So you kind of have to make them conscious and aware that this is something that might be of interest to them, that you're interested, you're sincerely curious about it, and hopefully that will get people to participate as well. And I forgot to ask you, who were your supervisors?
Dr. Elise Matthews and Dr. Brenda Rousseau Kimball.
Okay. So you had a different situation of actually working with 2 people.
Yeah.
And what's that like? I know it's different. Most people tend to just have one and then a committee, but what's it like working with 2?
It was great. I've been working with Elise for quite some time now. And she's not actually in the Kinesiology and Health Studies faculty. She's in the nursing faculty. So we kind of wanted to work together more. And Brenda was really great to come on board to facilitate that for us. It's nice having 2, like obviously my situation might not be what other people's situations are. Right. But like they both got along really well. They're both very much into qualitative research, but like different lenses still. So it was really interesting to get both of their perspectives. And like both of their feedback was like very different. But like I did learn a lot. Yeah. Which is lovely.
Yeah, it is great. Sometimes it's challenging with 2 because there could be contradictions or difference. Yeah. But sometimes you're doubling actually what you get out of it.
Right. Like I think I was very fortunate in that like they worked really well together and we're both very excited about the project. And had different lenses so that they could provide different type of insights for me.
So one of the things, again, I'm just going to sort of follow up with it, about advice is because you also work. And where do you work?
I work at the Canadian Institute for Public Safety Research and Treatment here at the University of Regina within PSPNet, which is the online therapy unit for public safety personnel. And I recently promoted to research associate thanks to the degree. So
nice.
That was very exciting. Yeah.
And so what is it like working full-time and then also being a graduate student? And maybe even focus a little bit of how do you get done? What are some things that you had to do to keep yourself moving and progressing and actually getting things done?
So I was really fortunate where PSPNet was incredibly flexible with me. So like during the classes, I just flexed my hours a little bit, you know? And that was easy. And then they were really accommodating when I needed to cut back on my hours a bit.
Okay.
So I think the lowest amount that I was doing was like 32 hours a week.
Okay.
Which is still a lot.
Yeah.
It was still considered full time. So I had like 2 half days and I used that 4 hours or whatever to like do my master's like very intensely.
Yeah.
I don't know. I also used like vacation time if I needed it to work on it. It's really just scheduling, setting the time. Like during the class phase, it's not too hard to do that. It's already structured. Yeah. It's like when you're really getting in on your thesis that you have to really pretend that you're in class still and still set those times. Like, I don't know. I feel like I've just been doing that for a while and like just very rigidly setting a schedule. Like even in my undergrad, like I worked 8 till 4:30.
Wow.
It didn't matter if I had classes or not. That's when I was working.
Yeah.
Because after 5 o'clock, I don't want to do anything.
Yeah. Yeah.
So I was like, in order to get this done, that's what we're going to do. So I kind of already had the structure in place for the master's. It's just like a little bit even more open.
Yeah.
And then I guess a little bit less time. So then it's like every other weekend you're working kind of thing.
But I think, in some ways it sounds easy, but it is challenging because once you get out of the classes, it is unstructured time for you to do your writing, collecting data, doing a data analysis. But I like how you kind of put that idea of like, you say, this is my work day. And my research is part of my work day. Yeah. So I need to do that. But that means you're committed to it. Like you do it. And I think when that doesn't happen, it's very easy for that time to just go.
Oh, for sure. Like I can't imagine. I've been trying to like slow down a little bit. Yeah. But I also want a publication and I should be putting that out there, right? Like people, the interviewees at least deserve to have like that written up. I should be doing the extra work. Yeah. So like I've taken a bit of a pause, but right away here, I'm going to be setting aside like a couple hours, at least one day a week where I'm working on that to get it done. Cause like I'm already like, it's almost the end of April and I like I don't have a draft yet. Yeah. So like, you just need like really concrete timelines. Like obviously your timeline's going to change. Grad school's chaotic, but like have them. Like I think I have a Word document with like 20 different timelines. Okay. Because I would make the timeline, something would change, and then I'd make the new timeline, and then something would change, and I'd make the new timeline. But like you need some sort of plan. Yeah. Like just abstract, it's going to happen. It's not going to happen.
No, but it is something to work towards. Yeah. Even if it does change, because I think otherwise, if you don't have that plan, it is so easy for it to be, it just disappears.
Yeah, I don't know how you would do it without it. Yeah, Like I like a list. Yeah. I've always liked a list.
Lists are good.
I don't know how people live without them. Yeah. So if you're going into grad school, that's okay. Yeah. Maybe just test out lists.
Yeah. But I think it's a good piece of advice to understand that you do have to put time in, you have to be committed to it. And again, you also even mentioned, which is sometimes difficult to do, is that you used vacation time to work on this, which some people are like, well, I have to give up my vacation, but it's a bit of a compromise. If you don't do it then, it's just going to mean it takes extra time. Yeah. So
yeah, kind of like I'm definitely appreciative to my husband who like, cooked meals. Yeah. Cleaned the house. Yeah. Did my laundry. Yeah. Like I'm very privileged that he was willing to like pick up the slack. Yeah. Because I didn't have the time for it. If I wanted to be putting that time towards getting the degree done in that shorter time frame, right, while continuing to work full time. Yeah. Yeah. So like nice. There's definitely sacrifices.
Oh, for sure.
If you want to do it like that. Yeah.
So one thing, maybe I'll just end with this is, so again, do you have any advice just in general to grad students coming into, like, what is a master's like? Because I don't think we always know what that is. We're kind of like, oh, okay, we're going to go do some more school and do some research. But what would you tell the master's students that are coming in the fall? Like, what is it really like? You're now done. What can you tell them?
That's a good question. Maybe just spend a lot of time looking into what you want to do. Okay. Like, make sure it's something you're passionate about.
So you're talking more like the topic?
Yeah.
Okay.
Like, because the classes are just a couple extra classes. Yep. Like, I don't think that's really, like, the big thing. No, it's not. Like, if you're doing a thesis-based, like, the big thing is, like, really just reading as much as you can about what you might want to do. Yeah. And make sure it's something that you're really interested in. Yeah. Like, I can't imagine doing it, like, with something that, like, didn't, like, make me cry every time I read the interviews. Like, Yeah.
Yeah, so you have that connection to it. That's,
Right?
Yeah, you feel
Like
really
that you
committed to
know
it.
that this is going to be meaningful
Yeah,
and it's important.
yeah.
You know, like it's hard to find a topic like that potentially, but like, I don't know, there's lots of things out there.
Well, I think that you can connect in different ways. Like
Right.
whether it could be emotionally, it could be curiosity based,
Yeah.
it could be, it's similar to your lived experience.
Yes.
There's lots of different ways I think to connect to topics, but I think if you don't have that connection, I think it is very easy to lose motivation. And then you're not going to finish.
And it's all motivation.
Yeah.
Like you can't get through it if you're not motivated to do
Right.
it. Because no one's holding your hand.
Nope.
Like you have to do it yourself.
Yes.
So yeah, definitely just try to find something that you're really passionate about.
Yeah, that's great. Is there anything else that you think I didn't ask or that you wanted to share as part of this about like your experience as a grad student or advice or anything like that?
I don't think so.
Okay. All right. Well, that's great. Thank you, Abby, for coming in.
Thanks for having me.
All right.